A newborn preterm infant, born at 30 weeks, is struggling with breathing shortly after delivery. The neonatologists are concerned about respiratory distress, and so a chest X-ray is quickly obtained to help guide the diagnosis. As I review the X-ray, the first thing that stands out is the appearance of the lungs. They have a characteristic ground glass appearance, which is a term we use to describe a diffuse, hazy, and somewhat homogeneous look across both lung fields. This suggests an issue with the air spaces in the lungs. It's not patchy or localized, which rules out some infectious causes like pneumonia, and the symmetrical involvement really grabs my attention. Further, I notice the presence of air bronchograms. These are tubular structures that remain visible because the surrounding alveoli are filled with something other than air, in this case, fluid or collapsed alveoli. The lungs appear smaller than usual, which is another important clue. The reduced lung volume suggests that this baby's lungs are not fully expanded, further hinting at an underlying surfactant deficiency. With all these findings combined, symmetrical ground glass opacities, air bronchograms, and reduced lung volumes, I'm strongly leaning towards a diagnosis of hyaline membrane disease, or respiratory distress syndrome. This is a common condition in preterm infants due to their underdeveloped lungs and lack of surfactant, a substance that helps keep the lungs expanded and allows efficient gas exchange. Now, there are a few other things to keep in mind. Neonatal pneumonia could give a similar picture, though it tends to be more patchy and less symmetrical. Transient tachypnea of the newborn is also a differential, but it typically presents with well-expanded lungs. Meconium aspiration is another consideration, though it's more common in term or post-term infants and presents with more heterogeneous findings. In this case, the clinical scenario of a preterm infant with respiratory distress, coupled with the classic radiographic findings, points to hyaline membrane disease. This baby would likely benefit from surfactant replacement therapy and supportive care, which can significantly improve outcomes in cases like this. Thanks for sticking with me through this case breakdown. If you enjoyed this discussion and want more in-depth explorations of radiology, don't forget to subscribe to Radiology Made Easy. And if you'd like to help keep this content coming, consider supporting us through the Buy Me a Coffee link in the description. Your support helps us bring you more insightful discussions like this one. See you in the next case.